right, welcome back. And like we said, our topic is bringing quality healthcare to the fingertips of Nigerians. Our guest is the head of partnership, Ota Akhigbe, if I got that correctly. She's head of membership and partnership at the Private Sector Health Alliance of Nigeria, PSHAN, who is responsible for forging partnerships and mobilizing funding from high-level players in the business sector to contribute to health reforms within the alliance. This is very interesting, and I believe it's a conversation that we need to have when it comes to healthcare and partnerships. A lot of focus is really on just that healthcare part, but the business alliance part is something that we don't really see so much. It's not something we see in Nigeria. But so I think that, like we said, the primary healthcare sector in Nigeria is plagued by so much inconsistencies. There's a lot of things that are not going right. But I think that we'll come to, let's look at the post state of the healthcare sector. What are some of the things that can be revitalized? Then we'll now come to what you're doing to revitalize it.
All right. Thank you so much. And it's such a pleasure to be here. So just straightforward to answer the question, like a couple of the things that can be revitalized in the healthcare sector at the moment. First of all is accessibility to healthcare. So a lot of Nigerians have an issue even accessing healthcare. And sometimes people will just decide not to bother going to healthcare centers to get treated, because when you think about the hurdle, the expense, you need to pay out of pocket, they don't even bother. So that is one issue, accessible quality healthcare. Another major issue is also infrastructure. So we have a lot of healthcare centers across the country, but most of these healthcare centers are not functional or are not functioning as they should. And that is a big deal. So even if you're signed on to an insurance, let's even say you're not paying out of pocket, so you're signed on to your state health insurance, and you go to those healthcare centers, you may not have the level of quality that you desire that can help address whatever need you have. And so that's infrastructure is also a big element. So I think those are two major things, a lot more, but just starting the conversation, those are two things I can just talk to.
So your organization and what you do with your role in your organization, you help to pull partnerships together to help the public sector, the government as well. So walk us through some of the projects that you've done in time past.
Thank you so much, and you're absolutely correct. PSHAN, which is a short form for our organization, is a high-level convening of private sector leaders with a focus on improving health outcomes in Nigeria. And over the years, we've touched a number of sectors to do this. We've done such projects like the Nigeria Healthcare Quality Initiative, which basically focused on strengthening the healthcare system. We also have the Africa Resource Center, which started out as a program for PSHAN, but is a standalone organization at the moment. And the aim of that organization is to strengthen the supply chain sector in Nigeria. We also have the Health Strategy Development Foundation and the Healthcare Leadership Academy. So these are some programs that we have done that are bordered on strengthening the healthcare system, strengthening the supply chain system, strengthening leadership development and healthcare strategy. And currently, we recently launched our flagship program called the Adopt a Health Facility Program, which was conceptualized to meet the ongoing needs of the healthcare sector. And the aim of this program is to provide one standard primary healthcare center in each of the local government areas in Nigeria.
Wow.
And yeah.
That is a lot. So when you talk about each of the local government areas, that's Lagos, Nigeria?
Absolutely. 36 states.
36 states.
Yeah.
So how many does that come to?
So that's 774 across the country.
Okay. And okay, talking about the personnel now, I know that it's all about partnerships and bringing different people together. So what do you look out for? Who are the types of people you reach out to be a part of this project that you've embarked on?
Thank you so much. Really good question. Just to quickly mention that we started out with a pilot project by revitalizing 2 primary healthcare centers, one in Delta State and one in Bauchi State. And then our plan is to replicate what we've done in those states and scale to other states in the country. So just to answer your question, there are so many, the beautiful thing about the ADHFP is that it's a very diverse pool, and there are various stakeholders that we reach out to support us. For us, what we're trying to do is to convince every Nigerian that regardless of your income bracket or where you feel you are, you can be a part of the project. So we're reaching out to corporate organizations, philanthropists, individuals who can join forces with other people to provide funding, to provide expertise, to provide in-kind support, to provide awareness, to help us to amplify the voice of what we're doing. So there's just so many moving parts, and there's so many elements and so many people. Basically, I think the underlying message, because the objectives of the ADHFP really are centered around healthcare improvement, equitable access to healthcare, and quality assurance. And these objectives speak to what matters to PSHAN, which is sustainable development. And it is a collective responsibility for all Nigerians.
But my question is, for the benefit of the average Nigerian who can't afford a quality healthcare, how would it benefit them in the long run? Because when we say that we want to have a healthcare system in every local government area in Nigeria, there's just some places that are not developed, that they can't even access internet or technology, or they're cut off. So how would it benefit, those people?
Thank you. Really brilliant question. So for us, the targets, the focus of this program is actually the vulnerable groups, the low-income earners, people in hard-to-reach areas in Nigeria. You know, primary healthcare centers are actually the first point of call. And our idea for this program is setting up primary healthcare centers in rural areas. So in terms of how it will benefit the community, when we have standard primary healthcare centers in these rural areas, one of the things we're doing is, of course, bringing to them accessible quality healthcare, but we're also helping them develop a sense of ownership, because this is development coming to their community. Then we look at things like helping them with better treatments, which in turn will provide jobs for the people in the community, which will provide empowerment, because we also focus on reproductive and women's health service. So we're looking at things like gender empowerment, job creation for the people in the community, you know, adhering to quality standards for healthcare. So the bigger picture for the program, of course, is health, but ultimately economic development, starting from the communities that these PHCs are going to be located in.
All right, let's talk about volunteers now. So all the personnel that you use, talking about the doctors, the nurses, the people that are going to be planted in some of these communities, are they volunteers, or are you also taking volunteers to be a part of this project?
Really good question. Yes, we work a lot with volunteers, even from the program angle of the program delivery. We work with volunteers, people that have expertise and knowledge, and they're coming to contribute their knowledge and the expertise towards the sustenance and success of the program. But even at the PHC level, yes, we're working with volunteers in the centers that can also work with us to make this thing work.
Okay, but looking at the JAPA syndrome that we have currently, a lot of qualified, and I was reading news that in UCH, 665 workers jackpot, brain drain, especially in the healthcare system industry. How would that obviously affect this program that you're working on? Because some of these personnel are high qualified doctors who can't just function here anymore because of the way the structure is.
Yes, so really true. I mean, the brain drain is real and it's here. And that is one of the things that the program is trying to address is you provide standard primary healthcare centers, you recruit workers and pay them good pay. The environments are conducive for them to work, so it's not so harsh. Because one of the reasons why a lot of people are leaving, beyond money, is also the harsh environment, the fact that things are not available. So we have centers where we're providing back-to-back, end-to-end rather, medical equipment, drug supplies, infrastructure, the facilities that are necessary for that center to run. And so our idea is, through this model, we would encourage and attract people to want to go and work for those primary healthcare centers. And over the long run, we would see more attraction and retention. That is actually some of the things that we're looking at with the program.
So when is this starting off? When is it kicking off? What are some of the things that the average Nigerians can benefit from, like in terms of they want to be part of the program, they may not be in the healthcare system, but they also want to plug in. How can they be involved?
Yeah, so we started off with a pilot project, and we just launched the 2 PHCs, like I mentioned earlier this month, and so we've officially started the program. And some of the things that Nigerians should know, like I said before, this is a collective responsibility. We all Nigerians, we all come from local government areas in different states. So what will benefit Nigerians is understanding that, oh, in my local government area, I have a standard primary healthcare center there. I may be living in Lagos, I may be living in Port Harcourt, but my people, my cousins, my relatives in those communities have access to this standard quality healthcare. And I can be a part of it. So there are different ways you can be a part of it. The name of the program is Adopt a Health Facility Program, where people can actually adopt PHCs, but some other people may choose to fund various lines. So you may decide my passion is maternal health, and so I want to fund maternal health. Or you could come together with a group of other people, maybe 20 people, 10 people, 50 people, and put funds together to fund a health center. Or you may not even want to do that. You just go to our website and donate via the crowdfunding platform there. And also, even apart from funds, because I know these 4 areas I talked about have to do with funds, sure. you could do in-partner contribution, for in-kind contribution like volunteering your expertise, volunteering your time. You could also spread the word, help us put the word out there, both in Nigeria and outside. There's so many interesting parts and how we can all be a part of it.
I still have one last question. How do you think that we can get healthcare right in Nigeria? I mean, primarily, I know that it's from the local government. If all our local government, like the healthcare in the local government works. But what are other ways, or would I say, what are your thoughts on how best we can get it right in healthcare in Nigeria?
So, yeah, like you said, one way is getting the primary healthcare centers at the local government area to work. That is one way. But also, governance and leadership is an important part of any transformation. The overall objective of this program, like I think I mentioned before, is economic development that is sustainable. So governance, and that's why governance and leadership is a key part of this program. Changing the mindsets, even the people, the beneficiaries of this program, understanding that my health is important to me, and so I would register for health insurance. I'm playing a part. I'm not just waiting for you to donate it to me, you know. So I think how we can, it's baby steps, but changing the mindsets around ownership, accountability, leadership, and governance.
Okay.
For those out there that would like to be a part of this, is there a website? Is there social media platforms that they can follow to reach out to you?
Yes. So the website for the Adopt a Health Facility Program is ADHFP.org. The website for PSHAN is PSHAN.org, and please follow us on all our social media platforms from LinkedIn, Instagram, Facebook, and Twitter. Yes.
Well, those are the major ones.
I'm going to say TikTok. Thank you so much, Ota Akhigbe, for coming on the show and giving us this insight on how best we can bring quality healthcare to the fingertips of Nigerians. If we can do that, we won't need to jackpot to go and get healthcare. We'll be able to get healthcare. Chikazi said no, because
there won't be any brain drain. You know, but
and people would, if you can invest in our economy, I mean, you come and do surgeries here in Nigeria. That's the dream, that we're able to do surgeries and top most discoveries here, and then healthcare tourism will be a thing in Nigeria. People will come back here in Nigeria. Thank you so much for sharing your thoughts on this amazing project. And